Now, Rwanda has achieved most of its Millennium Development Targets for health, and observers say the country is making some gains toward the Sustainable Development Goals of 2030. But some challenges remain, and we will look at what is being done to address them. Joining us for more on the subject is Catherine Mugeni. She's Director of Community Health at the Maternal Child and Community Health Division with Rwanda's Ministry of Health. Catherine Mugeni, thank you so much for joining us.
It's a pleasure for me.
So there have been so many good news about Rwanda and the progress made in terms of addressing maternal and child health. What have been the most successful maternal child health interventions in the country?
Yeah. I think we achieved a lot. We achieved the MDGs, especially the delivery at health facilities. And because of the intervention the government, through the Ministry of Health, put in place, like to increase the antenatal care, to increase the postnatal care, all women come to deliver at health facility, and after that we provide them a package of service during the postnatal care. Those are the key program intervention we have put in place. Also, there is also basic emergency obstetrical care. The health provider is supposed to give during at health facilities when the women have a problem. We have also some program like facilities like the ambulance when we have some pregnant women at village level. Yes. Start the labor, yes. The ambulance can go to pick them up to the health facilities.
That's very interesting when you talk about the ambulance picking them up, because one of the challenges that we have seen is in rural areas, for example, women do not have access to healthcare centers, or the treatment or the services cannot reach them. So tell us about how some of the ways that the Ministry of Health, your service, your department has been able to address that.
Yeah, I think for those problems, we put in place a system at community level. For example, we have the community health workers who monitor those pregnant women. They have registered, they follow them, and they encourage them to go to deliver at health facilities. We have what we call the rapid SMS system, and this system sends an alert when the pregnant women have a problem at community level. It's like a big commitment at all levels to decrease the maternal mortality, and in Rwanda, especially at community level.
So let's talk about the healthcare workers. Capacity building is so important. In some areas, you don't find the providers, you don't find the expertise. So how has the ministry been able to support that in implementing capacity building in order to decrease newborn death and also postpartum family planning?
We know that the health the human resource of health is a big pillar in our health system. And with Partner, we have designed a model to emphasize the capacity building of health workers through different ways, like we produce with MCSP.
And that's the Maternal and Child Survival Program, yes.
Yeah, we produce the tools can help them to easily understand what they're supposed to do when it comes, for example, for resuscitation for the baby. And for that, we change and institutionalize those tools, mentorship tools, and we train them. And after the training, there is like a Rwanda Association per Tradition, follow them at the fields, and they come also at the district level, at the hospital, to exchange with other health workers on the challenge they're facing during the service.
And we're out of time, but I just wanted to quickly get your take on the best way to reach women with unmet need for family planning. That's one of the issues that you've been addressing very quickly.
Yeah, I think we have started what we call the PPFP, the postpartum family planning, and because the rate of delivery at health center is very high in Rwanda, and what we do, it's a big opportunity. We don't miss this opportunity to start to be focused on long, modern methods.
Okay.
Yeah.
I think there are some lessons there to be learned by others. Thank you so much for joining us today.
Thank you.
And that was Catherine Mugeni. She's Director of Community Health at the Maternal Child and Community Health Division with Rwanda's Ministry of Health.